Sure, my name is Zamir and I am 37 years old. I remember I used to feel very tired and I'd wake up in the middle of the night because it felt like I was out of breath. I felt like I was stopping breathing. And once I was on a trip with my cousins and they videotaped me and I saw that I actually stopped breathing. And so I had quite a bit of concern, and that's when I reached out to Dr. Amita Bala.
Zamir had severe obstructive sleep apnea. Obstructive sleep apnea is a disorder where one does not get enough air when they sleep. And because of that, they have drops in oxygen. Those result in the patient feeling tired and lethargic when they wake up, and the tiredness might turn into sleepiness as the day progresses. Also, with obstructive sleep apnea, one can have effect on their cardiovascular system, raising their blood pressure, increasing their risks of heart attacks, strokes, progressing diabetes, and hypertension. Zamir had obstructive sleep apnea that was very severe, and the drops in oxygen were critical and at dangerously low levels. He was a classic patient that if we find that their sleep apnea is untreated, then these patients can actually die during sleep. So it's critical that we treat severe sleep apnea, but all sleep apnea needs to be treated because very good science has shown in the last few years that untreated sleep apnea does affect one's survival risk, and treating sleep apnea with the machine adequately will decrease the risk of heart disease, stroke, diabetes, and hypertension, and improve the survival and quality of life.
Sleep study was great. Dr. Amita Bala felt that for me the best option was to do it at the sleep lab at the hospital. I know that for other patients that there's an option to do it at home as well, but she felt for me that the lab was the best way. And that experience was actually great. I just went to the lab and you're taking a test by falling asleep. So they put just a couple of non-intrusive strap on you to monitor your sleeping, and after a few hours they wake you up to try you with a CPAP machine. And honestly, it was the best night of sleep I ever had after that.
I see patients like Zamir all the time. Patients who have obstructive sleep apnea are more and more aware now of the disease, as opposed to many years ago when people didn't know what it was. Now, when people snore, when they're sleepy, when they or their bed partners notice that they're stopping to breathe, they do come seeking help. They sometimes come directly to our clinic, and sometimes they're referred to us by other doctors. Certainly, if a patient has hypertension that's progressing rapidly, atrial fibrillation, congestive heart failure, those patients have a high incidence of obstructive sleep apnea or another sleep apnea called central sleep apnea. And so we see a lot of referrals for those patients as well.
I feel like a new man. I don't know how I lived before this. Dr. Bala guided me through the study and through how to use my sleep apnea machine. Now I have so much more energy. I wake up ready to go. I don't feel sleepy at all during the day. I get a great night's sleep, and honestly, I feel strongly it saved my life.
The treatment of sleep apnea in my practice is more centered these days around the AutoPAP, which stands for Auto Positive Airway Pressure Machine. This treatment is again done in the comfort of the patient's home. I prescribe the AutoPAP to the patient with certain settings and the smart card that's going to record the apnea-hypopnea index, the leaks, and the compliance. The patient also gets prescribed a mask of their choice, a hose, and a heated humidifier in most cases, and they sleep with this machine in their house, and that's their treatment. I set a wide range of pressure on this machine so that it gives the machine the leeway to decipher if a patient is having sleep apnea events and to treat the patient accordingly. At the subsequent visit, I will then download the smart card and look at the pressure that the patient is needing. And depending on the 95th percentile mean and average pressures, I then taper or narrow the pressure range to make it more accurate for the patient's particular disease.
At first I had concerns that maybe the sleep apnea machine would be difficult to wear every night, but Dr. Mitabala was really good in kind of explaining to me, the different choices I had and choosing the one that fit my body and my face the best. And it's really not intrusive. You barely know that it's there. And honestly, the sleep that you get is so much better than the sleep that you would never have gotten, that it's worth wearing it every night. I do travel with the machine, and it's something that, I'm on the road quite a bit and I travel a lot, so for me to be able to take it to the hotel, it's quite easy. It's got its own case and it's not very heavy to carry, and it gives me the most energy I need to go to my meetings and be successful at what I do. I take the machine on the plane with me, and if it's a long flight and they have the ports where I can plug in, I'm able to use it, and it works out great.
I follow the effectiveness of a patient's treatment, number one, by their response, their symptomatic response to the treatment. So once I start the treatment, I explain to the patient exactly what the treatment entails. The treatment varies for mild sleep apnea from dental appliances to when you have mild, moderate, or severe sleep apnea, we use the machines which deliver positive airway pressure. These machines can be a CPAP, that stands for continuous positive airway pressure, BiPAP, that stands for bi-level positive airway pressure. It gives one pressure when the patient inhales and drops the pressure when the patient exhales. AutoPAP, wherein the machine senses how the patient is breathing and how many events the patient is having and delivers pressure appropriately. And there's also another device called ASV, or Assist Zero Ventilation, that we use in a few of our patients.
Dr. Mitabala really cares about her patients, and so she reaches out often to make sure that we're okay and that we're using the machine. Whenever we come in for our follow-up visits, the sleep machine has a smart card that tracks how we're sleeping and how the machine is working for us. And so through that, she's able to help us to make sure that it's set up the right way and that it's continuing to do what we need. And so she really puts the effort in to make sure that we're okay. I would 100% recommend Dr. Amita Bala to all my friends, family, and even people that I haven't met yet. The whole process was easy, and it was life-changing. It saved my life. And I waited 3-4 years before I took the study, and I wish I would have done it sooner. It gave me so much more energy. It has changed my life. And if there's anybody out there thinking about doing it, don't think about it. Just go get it done. See Dr. Mitabala as soon as you can. It honestly will save your life.